So the best questions to ask your doctor is, how am I doing? How are my kidneys? What's my kidney function? What stage kidney disease am I in? What are we doing to prevent my kidneys from getting worse or to get them better? Am I at my goal blood pressure? What blood pressure should I be at? And what do I have to do to get there? How are my blood sugars? First ask, do I have diabetes? Am I at risk? And what do I need to do to decrease the risk? And lastly, am I on all the right medications that will protect me and keep me from dialysis and other complications? Sometimes they start to ask and they get shut down by their doctors. Oh, you're asking too many questions. I only have 5 minutes, or just, I have one person who told me before, when you come in, you're only allowed to ask me 2 questions because I have too many patients in the clinic, in my clinic waiting. It's unfortunate, but it's true. So, it is hard. I have patients that get mad and they go to another nephrologist because I may get behind, but I say, when I close that door, it's me and you. I don't look at a clock, but you have to understand, you have to respect the next person when I get to that, right? So a lot of it is the time constraints. A lot of it is, there's some people who still believe in that paternal relationship with doctor and patient. Just do what I say. Here's a pill, just take it. I have primaries that are like, Crystal, you know what? I know that you're gonna talk to them, so I'm gonna refer them to you. I know their kidney disease is stage 2, but you're gonna talk to them and tell them what and I just don't have the time. So it's unfortunate, but it's true. That's the problem. So the National Kidney Foundation has a lot of resources out there. I brought some kidney cards today that it has a scan that you can, you'll scan the QRS and it'll come on your phone and it gives you all the information. But the website's on that. You can Google it and they'll give you a lot of information on that. There's just, even Fresenius there's just so many more, there's so much more information. So I'm also part of a Black Care initiative by Baxter, where we're actually going to the communities of color and giving more lectures and education on kidney disease. So again, being in this beautiful house of worship, that's what people do have in their communities. The more healthcare, health fairs, healthcare talks that they have and provide, allow them to come in as a resource. Hopefully if we work with a lot of pastors, schools, that's to be our resource. So we say, hey, you can go to the principal, say, hey, you have anything on kidney disease? Because my son just found out that his grandmother has kidney disease and they're scared that she's going to die. What do they have to do? And that may help them live better and actually help that grandmother do better. Or again, coming to the pastor and saying, hey, I have this. Well, let me help you find somebody who can help, and talk to you and provide you the resources. We may provide them with resources to have here so patients can look at it. And talk to friends, especially friends that are doctors. I have a lot of in different organizations, they'll call me and say, hey, this person found out they have kidney disease. Oh, this person, my cousin, started dialysis. Can I have them call you? And we hope that most of our doctors, especially our people, would take the time and say yes, by all means, to make sure that cousin of somebody, even if they're in DC, Florida, wherever, that we're taking the time to do God's work and helping educate them so they feel better. We make sure they're getting the right care, and hopefully, God willing, getting them a kidney transplant so they can go on and living their lives. Because the people who are doing the research aren't us. Like I said, when Dr. Jameson did do that in the ACTS trial, it completely changed the structure of how people started treating hypertension and eating even kidney disease from diabetes in the Black community, and saying, yes, see, if you educate on diet, you use these certain medications they respond better to, you can hit goals, you can make a difference, that'll decrease their risk of going on to dialysis, etc. We need more researchers that are Black, as Dr. Sanders talked about. We also need people who are invested in the community, and the people who have some information they live, they've lived that. So that's why, from my standpoint, I can ask my patient, all right, it was Thanksgiving, I know you had this. Or, I just know the questions to ask. I know that stress can cause hypertension. You said I had a patient, crackhead lived downstairs from him. She said, my blood pressure was perfect until this. Now I'm on 5 medications. I know that it's because this guy lives underneath me and I need to move, but I can't break my lease. After checking her blood pressure, I said, okay, you know what? I'm gonna write and you get out of your lease. I'm gonna say it's medically toxic. da-da-da. She left, she was able to move. When she came back, took her off 3 of her blood pressure medications, and her blood pressure was doing great. So we need to have people who are listening, right, to us, and there are people who aren't listening. And there's data that shows that when patients come in and they're talking to a doctor or going to the hospital, they aren't really listening to what the doctors aren't really listening to what they're trying to tell them. So we have to start teaching our doctors, our residents, our doctors in training, our medical students, how to actually listen, because with this computer system the way it is, they aren't listening and they aren't talking.